Stroke patients needing to leave the city to be seen by neurologists, waiting hours to be transferred, and falling through the cracks of San Antonio's medical system. It's a problem we've documented since May here in Reports on KSAT. And tonight, an exclusive report from Steve Spriester on what may be a solution, a local hospital system promising to step up for stroke patients.
So it kind of hurts down here. We suffer the same frustrations that our patients have.
An emergency room doctor sworn to help who many times felt helpless. Dr. Tim Taylor says San Antonio's old way of dealing with stroke patients in the ER was unorganized, frustrating, time-consuming.
When people have a stroke, it's almost like a brain attack. There's a clot stopping up a vessel, and time equals brain function.
Everyone's been let down.
The failings of the San Antonio system, Ray and Suzanne Hildebrand know well. It took 7.5 hours and a helicopter ride to Austin before Ray was seen by a neurologist. KSAT featured their story and call for change. On Monday, a change is unveiled.
Your stories and the stories in the news really have been a catalyst to help us make this a priority.
There's no group of doctors that's happier about what's going on than the 44 emergency medicine doctors in the Baptist Health System.
It's called the Brain and Stroke Network, the Baptist Health System, the Department of Neurosurgery at the UT Health Science Center, and private neurologists promising to provide round-the-clock stroke care.
Much like there's an organized system for trauma, we now have an organized system and teams available to treat stroke patients.
Comforting for patients and for those trying to save them.
The thought that my mom or my grandmother could have a stroke and I wouldn't have anything to do other than call cities like Austin or Houston, it was terrible for us.
Steve Spriester, KSAT 12 News.
Now, the Brain and Stroke Network will be officially unveiled in a news conference tomorrow. Part of the effort is also educating people on the signs of stroke. Under the plan, St. Luke's and Northeast Baptist will also move to be designated stroke centers.